Healthcare access is limited in parts of rural Nevada. In a Fox 5 special report, we took the trip to Tonopah to see how the town is handling the pandemic. Welcome to the town of Tonopah, Nevada.
Tonopah runs about 2,300.
The whole town's only 2 miles long, so
I like this small community.
It's a mining town with a haunted historic hotel.
this is a fairly tight community.
Mike Sane likes it that way.
Everybody knows everybody for the most part, and pretty much somebody's looking out for somebody else. That's kind of the way it is.
He's lived in Tonopah for 11 years. He moved here from California.
You didn't know anybody, you didn't know people 2 doors down, you know.
It's very slow and very quiet.
But that's not what lured Marie to town 4 years ago.
He did.
There aren't many cars on the road, but that's not because of the pandemic. You have to look closely to find the impact of COVID-19.
It really hasn't affected us that much. Go in there and there's no chicken in the store, and this is the only store.
Mike and Marie say the small town is already pretty good at social distancing.
Most of our activities are outdoors. You don't see anybody, so you don't worry about it.
We're trying desperately to keep it from reaching the rurals, because when it does, it'll get very, very hard very quickly.
Carmen Grieber is with the Northern Nye County Hospital District.
So it is our job to find a way to deliver health care here.
A job she doesn't get paid for. She's a volunteer.
It's a heavy lift.
Tonopah used to have a hospital. It shut down in 2015. Now there's one primary care clinic and an urgent care that just opened last month. Tonopah is about 211 miles from Las Vegas, 228 from Reno, 100 miles to Hawthorne, home of the closest ER.
That has led to a decreased overall health.
Anything that's a little bit complicated requires specialized equipment. You gotta travel.
Like when Mike cut his finger pretty badly last fall.
Had to go up to Carson City and I had to get it sewed up.
Elena Marie Peterson is a nurse practitioner, the only one at Tonopah Primary Care.
But primary care in a rural area is way different than primary care in a urban area.
She moved to Tonopah from Las Vegas.
The delay in care could actually take a life, could affect someone's long-term outcomes.
I don't want it to reach the rurals. They don't want it to reach the rurals. But it's very hard to get people to heed the directives to maintain the hygiene and the safe distancing. Other things that would save them when it does hit. We don't have a healthy community, and we have a number of our constituents who are in the mid-50s, 60s, 70s, who are distinctly vulnerable.
And we've been making, phone calls to check on our elderly.
Have you seen people with coronavirus-like symptoms but just haven't been able to test them?
Yes, I have.
She just got tests last week.
Does that concern you? Does that concern your patients?
I would say that there's a big yes on that, not being able to test for it, knowing that it's there.
Anybody who were to be testing positive here would have to go someplace else very quickly for actual life-saving treatments, and the metropolitan areas are swamped and overrun as it is.
We're not an ER.
Marie told me her patients have been heeding warnings, but Carmen's not so sure.
There is a mindset in town. You feel you're stronger than this. The city slickers are just weak and soft, and we're tougher. It's somewhat of a joke. It's all fun and games until someone gets hurt.
And what if someone needs to go to the hospital?
We would stabilize, isolate, and they would have to find a place to receive them. Not here.
Or needs a ventilator?
There are no ventilators in our district that I'm aware of.
But even without access to the health care, it's not his neighbors Mike feels sorry for.
But the large cities, New York or Seattle up that way, I feel sorry for them. One of the things people have warned about for 30 years or more is something like this, a pandemic coming. Because people live on top of each other, it's going to spread worse in those areas.
Marie knows her patients need her now more than ever, and there's no place else she'd rather be.
It's absolutely rewarding. You feel very needed, and my patients are very, very grateful, very, very gracious about the care that they get. Very rewarding. Definitely a reason for serving this area.
The Nye County Health District reports 10 cases total so far, 7 in Pahrump and 1 each in Tonopah, Beatty, and Amargosa Valley.